Great. Thank you so much, Colin. That was informative as always. So we're going to begin our Q&A session. Before we do, just like to point out that we can we just wanted to show you some of your books. And I know you don't have any social media, so I guess they can just look you up online to learn more about you. If you
Yeah.
want to get the books, you can go through the bookstore, and which will have you, if you click on any of these books, it'll go through Amazon, but it will get a little bit to support what we're doing here at the Real Truth About Health conference. So with that said, let's go ahead and begin the Q&A. If anyone would like to ask a question of to Colin Campbell, they can go ahead and they can raise their hand in Zoom, and assuming we have time, we will get to those questions. So you said a lot of really amazing things, so I'm going to ask you some questions, on that. You mentioned statins with regard to cholesterol. Given that, cholesterol, based on what you're saying and what I've heard other doctors say, is a benchmark for heart disease and not necessarily the root cause of heart disease. What is the correlation between cholesterol and heart disease?
It's pretty good. I mean, it's pretty impressive. Higher cholesterol levels associated with higher heart disease. And of course, we would assume, therefore, that if we could just control cholesterol, maybe we can reduce heart disease. But, as time passed, and this is as it passed in the past, we learned that the real cause of heart disease is something different. The cholesterol in our blood, the level of cholesterol in the blood, is only an indicator of a risk for heart disease. And it's pretty well correlated. The higher cholesterol in blood, higher heart disease. That's an oversimplification, I must advise, because there's other things that cause high cholesterol levels, and there's no harm to be assumed. But just the whole idea of just tackling one tiny, tiny, tiny little bit of the equation, trying to reduce cholesterol, is kind of elementary. It doesn't make much sense.
Right. All right. But the statins, which reduces it, doesn't really necessarily help it because there's so many other factors, which is kind of the thesis of your
Right,
presentation today.
right,
Is that
right.
happening?
There's some studies. Let me add a little bit. There's a lot of studies on the relationship between statins and heart disease, and there's a few that somebody sent me a whole collection of all these studies. A lot of them, there's essentially no relationship. It's too complicated. At the best that I could find in that list was a 9% decrease in heart disease risk, 9% only. That was the best of the lot, and probably might be influenced by the thing. So reducing cholesterol through statins is when we can just do it like what Dr. Esselstyn has done. Just change the diet. That's simple. Esselstyn and Ornish.
So I believe it was you, and this is many years ago, so I'm not expecting you to remember this per se, but I believe it was you with a conversation on one of our panels with Dr. Kim Williams, and he was saying there was a statistically significant impact with statins.
Right.
Why would he come to that conclusion? Is there any evidence that supports what he's saying?
Well, it was really interesting. And you're referring to something. I'm surprised you remembered it. We were sitting next to each other. And so he
Mhm.
brought with him, he knew my views on that. And he showed me some paper at the table to say, no, no, this works. They had some evidence that, it might reduce it by 20%. He's an MD, and that's what they teach in medical schools. And he's involved in medical schools. And, they're told the best evidence that's possible, with regards to drugs. That's what my concern about medical schools is. Kim Williams is a great guy, by the way. I must tell you that. On a personal level, I like him. He's a smart guy, but I disagree with him. I mean, the data I had basically shows it just steers us in the wrong direction. I don't think he actually disagrees with me, to be honest about it. He couldn't say it publicly. Mike, I'm guessing here on that one, so have to be careful. But Kim is a good guy.
So, what would be a healthy range of cholesterol that we should be shooting for now? Because we've had a one PhD who spoke, and he had said that there's evidence that people with higher cholesterol actually do better, and that what was also said is that sometimes there are other things going on in the body. So people who are eating a healthy plant-based diet, for example, and actually doing it right, not just plant-based, but whole food plant-based, and still have a higher cholesterol, it may be because their body is producing higher cholesterol because of other things going on, and it may need to produce cholesterol. Is there anything to that?
No, I don't really know of anything. The only qualification I might add to this, to my point of view, his point of view, her point of view, but in any case, it's the fact that, and this is for me personally, it turns out I have pretty high cholesterol levels. When I came to Cornell in 1975, for example, really getting into this, at that time, we all had to take a physical because I was working with a very toxic chemical in the lab at the time. And so I did my physical, the first one I had in my life. My cholesterol level was 259. And that was pretty high. I said, what's going on here? Really started changing that much yet. But it was on the high side. My dad died of heart disease, all that. So, I'm at so a higher risk. I'm very conscious of it. Of course, then when you got to change their diet, it started coming down. But I could only get it down to about 170, 180, which is good, which is fairly good. But it's actually still high compared to what some people get down to 150, 140, maybe, something like that. But the word in the trade was that it don't go below 150. Maybe you don't go any lower than that. And because suicide rates are higher and colon cancer rates are higher. And so what? Good God, what's going on here? But I wanted to get my cholesterol down. It started coming down when I started eating the right way, and it got down to about 180. And I said, well, I can't get it lower. Our kids are, born, they're eating this way, more or less. They're down to 120, 110. And then the China study, the average in the rural Chinese was 120, really low. The average, mind you, it was below even the low range in the United States. And so then we compared the United States to China. That's another whole story, but and too long at that. But those of us who do not nurse, tend to have a higher baseline cholesterol level. I did not nurse. For some reason, I guess we were on a dairy farm, and so there was something about the milk that reacted with me. So my mother told me, and so I was given something different. And at that age, critical age, you get left with a little bit of something left over. You can't get cholesterol levels as low as what you might like. So I've been in but 170, 180 is okay. But the people who don't nurse have that problem.
So as far as a healthy range, assuming that someone nursed and they don't have that particular issue, and they're eating a whole food plant-based diet, what should they be hoping for? And if they're not hoping, or excuse me, if they're not achieving it, what would be healthy ways beyond just the whole food plant-based diet that they might be able to get into that range that you suggest? For example, red yeast rice, people talk about. Is that an option?
Yeah. The number that, at least for young people, that's just fine is 110, 120, 130 in that territory. We learned that from our work in China, by the way, as I mentioned. And so it's fine. We used to be that was too low, as I said. But no, in my estimation, and I think it's generally accepted now, is that our children who are born and nursed properly and fed the right food and so forth, they're going to remain around 110, 120. Our children, with five children, they didn't really get into this completely, except the youngest one maybe, but uh, so they're kind of rather low because they're eating the right kind of food. So let's say I'm going to just throw you want a number. I'm going to say too low is not too low. There is this that thing of being too low. 110 is probably as good as you can get. 100, 110, 120, that's all very good. But then on the high side, unless they're not nursed, going up as high as 180, 190, 200 is not so bad. So the normal range is somewhere 100 to 200, let's say. But
Okay.
now the discussion mainly is focused on not total cholesterol, but it's on the low density cholesterol, which is the different fractions of cholesterol, the one that matters the most. is the LDL cholesterol. Anyhow, let's say 100 to 200.
Okay, great. Thank you. And based on your research, is there any real correlation between cholesterol level and suicide?
No, I tell that because it was a typical misassumption at the time that I was actually working with the National Academy of Sciences. I mean, they were serious people and who were sort of in the field. They were suggesting that as the result of the level of cholesterol too low. When we got our data in China, no one wanted to believe it. So we had to go back and analyze it two more times. And finally, the people in the heart disease arena did start changing their views.
Great, thank you. So you brought up vitamin A and how with regard to lung cancer, and it turned out when people were taking vitamin A, they were actually getting higher rates of cancer versus what they were expecting, lower rates. And that kind of throws into question a lot of the idea of supplementation. Right. So I'm going to break it up into two things. So when people talk about supplementation, there's obviously, there's the vitamin A type of supplementation or very, specific nutrients versus taking something like curcumin, which is more whole food plant-based. If you'd
Right.
agree with that? Um, are there specific supplements that you would suggest taking? Are there specific ones that you would avoid? I know B12 is a must, is my understanding in especially with people eating a whole food plant-based diet, but the general
That's a stretch.
um D is another one that a lot of people in this community are fond of taking. What are your thoughts on supplementation with the nutrient specific supplements as well as things like curcumin or turmeric where you're eating more of the whole a whole food?
Well, you mentioned two things. Really, one point is well taken, namely, single nutrients is usually what we are accustomed to. And I don't see any need for including B12. Uh, I take a B12 to be honest about because my wife tells me to do it, but that's an overstatement. If you go back and I know the individual who actually promoted that idea, it really is an exaggeration. And but it's harmless in a way because it's water soluble. So if there's any benefit, if there's any effect at all, it's going to be beneficial maybe. So a lot of people take it, but I am not convinced of the data to say that we all have to take it. That's silly. It's just simply not there. On vitamin D, first off, the first point that I would make, vitamin D is not a vitamin. And that the fact that they called it vitamin D means it's important and we should be taking vitamin D and all that sort of stuff. What we need to do is get out in the sunshine. That's the best way to get a vitamin D. It forms in our skin. We don't need to consume it. And there's some difficulty if you get vitamin D. And that incidentally, it's too long to discuss here, but that really got wrapped up with an organization that supported the industry called the Vitamin D Council, trying to advocate, taking vitamin D for this, that, and everything else. No, it's not good. My vitamin D is considered to be too low. The range was normally 30 to 60 more or less that we should be at. My levels in blood had been around 20. But I've been out in the sun and everything else it was wrong. My wife is the same way. But now the medical community is coming around to say, oh, that's not so bad. So I've seen a shift in the attitude even on vitamin D. One of the things about recommended or not being that some of these nutrients being recommended, it is so wrapped up or influenced by, maybe I should say, by the industry. It so often happens that way. And so I don't take drugs. As I say, I'm 90. And when we get older, I will agree, though, that as we get older, our bodies become a little more depleted than the kind of nutrition we may have been accustomed to. And so maybe taking a supplement of even B12 and D, and even though I'm not fond of it, nonetheless, or maybe something else, that I don't know. Who am I to say? It's just on the basic theory that we tend to get kind of low as we get older, and maybe we can take a little bit, but I don't take those things.
So you mentioned that there was no real downside to taking B12. So I want to ask you two questions. One is, um, uh, how would we get it in our food? Because my understanding is it's not really prevalent in our food anymore. So the fact, do you believe that we are getting it through a whole food plant-based diet? That's the first question. And then you said that B12 isn't necessarily bad for you, so it's okay to take. Is the same thing true for D?
Yeah. Uh, well, as far as the supplements are concerned, we can uh, both the B12 and the D, as I already said. Uh, you know, if they want to take it, okay, go for it. But I don't see the evidence to justify doing that. It really it's just not there. So I tend to, well, why do it? I just eat the right food. There was a study in Switzerland, not known, on B12 on one occasion that I'm familiar with. It didn't get well publicized, but they were doing some work and found that in certain plants there was a B12 like substance that seemed to do the job in plants. And so and the evidence for using B12 came from a kind of a very questionable, highly questionable source initially. It was especially done on a little girl in Africa who supposedly suffered something. So B12 is significant, obviously, but the people in Switzerland found that there was some B12-like activity in plants of all things. So again, I don't get, but there's no hurt. Let's say it that way.
Oh,
If you taken, especially B12, it's water soluble.
and
And
then
so
D,
take it. But
and then D is that is there any hurt for taking D?
on the high side, there can be some difficulty.